Ever wondered what a lung abscess is and how it affects your body? Picture a cavity within your lung filled with pus, typically resulting from an infectious process. That, in essence, is a lung abscess. A lung abscess commonly develops as a complication of bacterial pneumonia. The infection leads to the death of lung tissue, forming a cavity within the lung that becomes filled with pus and cellular debris. It's a bit like a nasty pothole appearing in a road, only this one is in your lung, and it's filled with an unpleasant mix of bacteria and dead cells. Common culprits behind this are bacteria like Streptococcus pneumoniae, Staphylococcus aureus, and anaerobic bacteria such as Bacteroides species. What does it feel like to have a lung abscess? The symptoms may include a persistent cough, often producing foul-smelling or purulent sputum, fever, chills, and sweats. Chest pain, especially with deep breathing or coughing, shortness of breath and respiratory distress, weight loss, and fatigue. Occasionally, coughing up blood may occur. To diagnose a lung abscess, doctors usually use a chest X-ray, which typically shows a cavity or consolidation within the lung. A CT scan of the chest provides detailed imaging of the abscess, its size, and surrounding structures. A sputum culture identifies the causative bacteria and helps guide antibiotic therapy. Blood tests, including a complete blood count and inflammatory markers such as C-reactive protein, assess the severity of the infection. However, there are other conditions that can present similarly to a lung abscess. These include pulmonary tuberculosis, lung cancer, particularly with a history of smoking or other risk factors, lung infarction, which occurs in pulmonary embolism cases causing necrosis and cavitation, pulmonary fungal infections, especially in immunocompromised individuals, and bronchiectasis, where dilated bronchi can sometimes appear as cavities on imaging but have different underlying causes. Treatment of lung abscesses involves targeting the causative bacteria with antibiotic therapy, draining the abscess if necessary, such as with percutaneous drainage or surgical resection, and supportive care to manage symptoms and promote healing. Regular follow-up and monitoring are crucial to ensure resolution of the abscess and prevent complications. In summary, a lung abscess is a cavity filled with pus in the lung, often resulting from bacterial pneumonia. Symptoms include cough, fever, chest pain, and shortness of breath. Diagnosis is typically via chest X-ray, Connecticut scan, sputum culture, and blood tests. And treatment involves antibiotics, possible drainage, and supportive care. Always remember, prompt diagnosis and treatment is key to preventing complications.
The treatment of a lung abscess is typically a multi-step process. Step 1 involves antibiotic therapy. Targeting the bacteria causing the lung abscess is key. The choice of antibiotic is usually determined based on sensitivity tests of the pathogen, ensuring an effective clearance of the infection and prevention of recurrence. Penicillin, cephalosporins, and fluoroquinolones are commonly used antibiotics. Throughout treatment, the type and dosage of antibiotics may be adjusted by the doctor according to the patient's condition. Step 2 involves supportive care, which includes ample rest, fluid replenishment, nutritional support, and pain management. Patients usually need to rest to promote recovery and require sufficient fluid intake to maintain hydration and clear the respiratory tract. Step 3 is the evacuation of pus. For larger lung abscesses or those with significant pus accumulation, pus evacuation may be needed. This can be done through bronchoscopy and drainage, or in severe cases, surgical removal of the infected area may be necessary. Step 4 is the treatment of the underlying cause. If the lung abscess is caused by other diseases or conditions such as emphysema, tuberculosis, etc., it is necessary to concurrently treat the underlying base disease. Step 5 is monitoring and follow-up. During treatment, doctors will regularly monitor the patient's condition, including body temperature, respiratory rate, pulmonary auscultation, and blood tests. If necessary, radiological examinations such as chest X-rays or CT scans may be carried out to assess disease progression and treatment effectiveness. Finally, Step 6 involves preventive measures. Preventing the occurrence of lung abscess requires good hygiene habits, timely treatment of respiratory infections, avoidance of harmful gases and tobacco smoke, and vaccination with relevant vaccines such as the pneumococcal vaccine. To summarize, the treatment methods for lung abscess can vary based on the specific condition of the patient, the severity of the infection, and the sensitivity of the pathogen. Therefore, the treatment should be formulated and monitored by professional doctors based on the actual situation. This underlines the importance of early detection and timely intervention in the management of lung abscesses. So remember, when it comes to lung health, every breath counts.